One thing is that we've seen our normal approach to drug use, which is lock people up, put them away for as long as possible, is their fault, it's a moral failing to use drugs. That's been going on for a couple of decades now, pretty heavily. And we've seen that drugs have not gone away because of that, that addiction is only getting worse, that the cost of incarceration, both in terms of just in financial terms and also in human terms, has been substantial. And so people are starting to get tired of that. We see that in law enforcement a lot. The cops who started off at the beginning really gung-ho about locking up the bad guys, 30 years later, when the same problem is there, they're starting to finally sit back and say, okay, this is not working. We need to do something different. So that's one reason. It's just fatigue, sort of war on drugs fatigue, and recognition that these really harsh tactics have not worked. I think another major reason is honestly because the opioid epidemic is causing this change for a couple of reasons. One, because it's so widespread and it's so deadly on a scale that we haven't seen with other forms of drugs. And also because it's affecting affluent communities, white communities, children of judges and politicians and law enforcement. And so the folks who are in power and who have the ability to change the laws and to change policy around this now see people within their own families who are affected. And so it's more difficult for them to say, well, those people are bad and immoral and dangerous, and we need to get our people away from those people by locking them up. Now there's a blur between who us and them are, and it's forcing them to face this and to be more compassionate about it, which is good, but also very unfortunate that that's what it takes.
Go to killibycenter.com, Radical Recovery Summit, to see the full schedule of speakers and to register to watch these free online September 23rd and 24th in the Radical Recovery Summit 2017.